So Lauren, do we know if anybody else is joining us in terms of the press?
I'm here, Austin Getz from KNDU News.
Oh, hi, Austin.
Hello.
So no tips for virtual press conferences, huh?
I mean, I don't think anyone had ever really done them before now.
Well, GCACH likes to be the first and everything, so.
Trendsetters, I think they call that.
Yeah, it's a good idea. That's a good word.
Carol,
So
I got confirmation from Diamante Media, a radio station from out of the Tri-Cities. He's going to try to call in. He really wasn't sure with the technology, so he might be joining us on the phone only. So hopefully he's able to get through.
Well, I will let Lauren navigate us through this. I think when Brian calls in, we can wait a couple minutes and get started. I hear Brian now.
Yep, I just came in.
Okay.
Oh, there's Carol. I see you. Look at that. I can see you guys.
Yay. Well, you're not going to get out of this because we're going to put you on the screen. We have your picture, Brian.
Oh, great. Super. Super.
Did we Photoshop him in like a Hawaiian print shirt with like Maui in the background?
A mask. You gotta have a mask on.
Yes, and a mask.
Oh, I love it.
Okay, well, I think we can go ahead and get started. What do you say, Carol?
I say let's do it.
Okay, so my name's Lauren Noble. I'm the marketing manager at Greater Columbia ACH. I just wanted to first off by saying thank you everyone for joining us. I know it's a really busy time right now. We're excited to host our first ever virtual press conference. It's a first for us. I think it's a first for a lot of people. So hopefully there aren't too many kinks, but if there are, please bear with us. And we will be announcing our donation of $300,000 to Second Harvest. Carol, Second Harvest, GCACH staff, news, would you like to introduce yourself really quickly?
So I'm Carol Moser, the Executive Director of Greater Columbia ACH.
I'll just go down the list. Becky? You're on mute. We can't hear you.
Becky, you're muted.
Oh, I got it.
Okay, we can hear you.
Sorry. I am the Director of Finance and Contracts for Greater Columbia Accountable Community of Health.
Great. Chelsea? We can't hear you, Chelsea. Okay, we'll skip Chelsea, but Chelsea Chapman is our administrative assistant at Greater Columbia ACH.
I'm Diane Halo and I am the Integrated Managed Care and Opioid Resource Network Project Manager.
Rachel?
I'm Rachel Guest, and I'm the Finance and Contracts Coordinator with Greater Columbia.
Ruben?
I'm Ruben Peralta. I'm the Community and Tribal Engagement Specialist for Greater Columbia ACH.
Wes?
I'm Wes Lucky. I'm the Deputy Director for the Greater Columbia.
Andrew? You're speaking, Andrew. We can't hear you. We'll come back to you. Austin, if you'd like to reintroduce yourself.
Hello there, Austin Getz, reporter with KNDU News, KNDU, NBC right now.
Thank you for joining us. Brian?
Good afternoon. My name is Brian Gibbons. I am the board president for the Greater Columbia Accountable Communities of Health and Chief Executive Officer at Estrella Sunnyside Hospital, Sunnyside, Washington. Thank you.
Courtney?
Hi everyone, this is Courtney. Yeah, nope, just couldn't get off you quick enough. Good afternoon, everyone. This is Courtney Ward with Merit Group Washington.
Thank you, Courtney. Elizabeth?
Elizabeth Torres, and I'm the research coordinator for Proyecto Bienestar, but I'm representing Radio Cadena's news department today.
John?
Hi, this is John Raymond. I'm the COO of Hope Source in Kittitas County. We operate the food bank here. I'm also the vice chair of the Kittitas County Health Network, working with the
Great. Kendra?
I am Kendra Palomares, the Director of Tri-Cities for Catholic Charities.
Les?
I'm Leslie Stallnaker. I work for Educational Service District 123, and I serve on the board for Greater Columbia.
Martin?
Martin Sanchez, one of the practice transformation navigators for Greater Columbia ACH.
Neil?
Hi, I'm Neil Fisher with CapKVU Local News or reporter.
Great. Thank you for joining us, Neil. Sandra?
Hi, I'm Sandra Suarez with Yakima Valley Farm Workers Clinic. I represent FQHCs on the GCACH Board of Director and am the Vice Chair as well.
Okay, great. And then Second Harvest.
Yeah, Jason Clark, President and CEO.
Thank you, Jason. And I think I missed Laurel. I think you're muted, Laurel.
Whoops. Hi, I'm Laurel. I'm a new practice transformation navigator with GCACH.
Is there anyone that I missed that would like to introduce themselves?
Allison
yes.
from Keeper here as well.
Thank you, Allison. Was there one more person?
Yes, my name is, can you hear me?
Yes.
Yes.
My name is Luis Murillo with Diamante Media, Spanish radio out of Tri-Cities.
Great. Thank you for joining us.
Thank you.
Okay, Carol, take it away.
Okay, so in front of you guys, you should be able to see kind of the press conference agenda. We needed to be really organized because it's hard to know when people are speaking and not. So my goal today is to tell you a little bit about Greater Columbia ACH, especially Jason and the news media that are joining us. And Jason, we're just so delighted that you're here today with us, even virtually. But you might not know that Greater Columbia ACH spans 9 counties, so that includes Kittitas, Yakima, Benton, Franklin, Walla Walla, Columbia, Garfield, Asotin, and Whitman counties in the Yakima Indian Nation Reservation. We have about 710,000 in population, and about 35% of that population receives Medicaid benefits. So we understand the great need that we have for food assistance across our 9-county region. And I think that that was the main driver of when we received this request from Second Harvest. Holly reached out to us, and Holly isn't on the line now, but she has been a great supporter of Greater Columbia ACH since the very beginning, and she's been attending all of our meetings. So we feel very close to Second Harvest because of her presence at our Leadership Council meetings, and we just wanted to let you know that we really appreciate her. But our goal today is to tell you a little bit about Greater Columbia, why we were so interested in this project. And without any further comments, I think I will go ahead and turn it over to Brian Gibbons, our president of Greater Columbia.
Hi, good afternoon. I think that we are honored actually to be able to assist the Second Harvest group That's a nice picture there. We're honored to support the Second Harvest group right now. You know, we know that the thing that I think is that our community struggles with a little bit is food insecurity. We know it to be a major issue in our region. Our community is really everywhere. All the communities are really struggling right now with the stay-home rules and you know, it's very, very difficult. Everything has gotten much more challenging. So the ability to be able to step forward and to support the Second Harvest really makes a great deal of sense. We know the need is there. Second Harvest covers all of the counties within the Greater Columbia Accountable Communities of Health coverage region, and as a result, it just makes all kinds of sense to support Second Harvest, that they can support the other parties getting care out to and food out to the communities that really need it. You know, from the board standpoint, it was kind of a no-brainer. We're super happy. Okay.
Well done.
Thank you.
So,
thank you, Brian.
Thank you.
Go ahead, Carol.
Oh, no, I was just going to say, I think next up is we wanted to learn a little bit more about Second Harvest. And Jason, I think that's you.
Okay, my gosh, this is, you know, I kind of probably jumped the gun when I first jumped on the call, just saying, really have been eager to find some bright spots over the last few weeks, and this has absolutely been one of them. So I just want to start off with a really humble thank you. About fell out of my chair when Holly called and said, "You won't believe what's happening here." So thank you. And we're going to work really hard to put that to work right away for hungry people in the region. And as you noted, we have multiple counties that we're going to be able to support and affect with this gift. And I've been really trying to work over the last few weeks to articulate the scale of what we're trying to achieve. And I found that it's been really difficult because at Second Harvest, we generally kind of come at these difficult problems with a lot of optimism, and it feels like the way that we can help the community and help the people we serve is by being real solution oriented and trying to support them during a time of need. And I have to tell you, I've been doing this for 26 years, and I have just never, just like all of us in our daily lives and in our work lives, have never seen anything like this. I did disaster relief after Hurricane Katrina, and that was a very, very humbling experience, trying to support people in a devastated area. And this is like an economic devastation of that magnitude. And we're trying to climb up to distributing $1 million worth of donated food a week. That's twice what we were doing in the month of December. And I think we need to be at $3 million a week of donated food to really respond to this incredible surge in need. And even in Pasco, I don't know if Holly shared the story of the distributions we tried to do at our warehouse. We had 250 emergency food boxes. An estimated 600 cars showed up. The food was gone in 30 minutes, 40 minutes. So that's just the level of response that we're seeing. And folks saying that they're encountering this huge economic shock and trying to figure out how to feed their families right now. So I just want to share what an amazing gift this is as we try to chase. The expenses are growing rapidly. We are hiring temp drivers, renting semi trucks. We are paying for food when we've never paid for food before. So we're going to put those resources to work right away. And I just want to say thank you so much, and certainly happy to answer any questions. I know I don't want to drone on forever either, but it's certainly, you know, I think the neighborhood food banks that we serve, they are calling and asking for support all the time now. and saying they need more help, and we're going to do our best to get that headed their way.
Thank you for that statement. Is there any questions for Jason or Brian or Carol before we move on?
So Lauren,
Hearing none.
Lauren, I should probably say that so Greater Columbia Accountable Community of Health is one of 9 accountable communities of health across the state. And even though our primary focus to date, Jason, has been working with the providers that have a clinic that we're working with in terms of we do pay attention to the because personal health is more than what they receive in a clinic. That's kind of where Ruben, for all the specialty is dealing with the local community networks that deal with social determinants. So this is really an outgrowth of some of the work that Ruben has been doing in terms of community resilience and community outreach. And Ruben, I didn't know if you wanted to say anything or not about your program.
Well, you read my mind there, Carol. So yes, we acknowledge that most of our health, 80% of our health, actually is determined by social factors, by the area we live in, the income we're born into, the political situation in the country we're born in, whether we grow up with a two-parent system or whether we have, there are many of health. So in addition to our main projects, we are also trying to address those social factors, and this is one of them. We know that food and shelter are at the basic of the needs for survival, and that's what we're trying to do here. We are trying to mitigate potential physical and mental health issues in the future as a result of this pandemic and as a result of the financial strain that is going to cause on people to be able to feed their families. So hopefully this assistance is going to allow some people allocate their funds to paying the bills, rent, transportation, and some other basic needs as well. So like Carol mentioned, we are addressing the physical and mental health conditions at the root, and social determinants are at the root of health issues.
And Lauren, I don't know, is there time for any of the other directors, the board of directors, to say anything if they want to chime in?
Sure, of course.
We've got several directors on the line. Sandra.
I honestly, I just want to say thank you to Second Harvest for the work that you guys are all doing. And I know it's been a quick strain on your resources and your capacity. And as Carol or Brian, I can't remember which one said earlier, it really was an easy decision to support you all in the work that you are doing, especially given how much of our communities you guys do impact. And so we really appreciate what you're doing and are just really thankful that in these challenging times we're even able to help in some small way, because we know it's not enough.
Oh, it's huge. Thank you very much.
Actually, Jason, Kendra Palomares represents the kind of the faith-based, food-based sectors. And Kendra, I didn't know if you wanted to say anything on behalf of your sector.
Sure. I'll echo Sandra's statements. I know we have several different programs at our Catholic Charities office in Richland, and all of those clients are in need, I think, at this time. And so I know they really benefit from this service. So in full support, and we thank you for all that you're doing. I'm sure it's been very busy.
Oh, thank you for sharing that.
Les, did you want to chime in?
I guess the beginning of the Greater Columbia program brought people together from multiple agencies to sit down and find out what we thought would be better and what would really help our communities. And the things that help the people on the street, on the road, in our communities are things like having food and being able to have transportation and access to other services. And although we received funds and worked very hard to try and decrease the burden on Medicare for providing care, this has been a part of the heart of our organization, is to really make a difference for some people who can then hopefully step forward and live a little healthier lives and be able to contribute back into the community and strengthen the whole thing.
Thanks, Wes. So Lauren, are we ready for Laurel?
Do we want to present the check first from Becky?
Oh, yeah. We forgot about the big thing.
Oh. Okay.
Floor is yours, Becky.
Okay. Can you hear me this time?
Yes.
Yes.
Okay, so I created this virtual check to represent the real one that should have reached your bank account today. We are very excited and proud and happy to give this money to Second Harvest, $300,000, to help in this time of need to our population during this difficult time. So thank you guys for your hard work. We really appreciate you.
Oh my gosh, that is the best giant check I've ever seen.
That is a pretty good one.
Well done. Thank you.
Thank you,
Becky,
for all your hard work.
And then, without further ado, we would all just like to say thank you from Greater Columbia ACH. We have actually all created signs for Second Harvest on how we would describe Second Harvest. What's a trait of Second Harvest? So staff, if you can hold up your sign.
Oh, that is so cool. Hold on, I have to scroll through and look at all the pictures.
Hopefully you can see them all. Laurel, our practice transformation navigator, actually came up with this idea, and we thought it's a great way to show what your organization means to us. So thank you.
Oh, well done. What a great idea. Thank you so much.
Cheryl, I didn't know if you wanted to say anything else. Do you have any other comments?
I would just open it up to anybody else that's joining us today. If you guys want to make any comments.
Hi, this is Neil Fisher from GCACH Local News. Jason, I have a question for you. You mentioned that there was an estimated 600 cars when you guys had the 250 food boxes. Do you guys plan on taking any of this donation and putting it forward to another one of those programs?
Yeah, we've really been scaling up our distribution, and one of the ways we're doing that is with our mobile market program, and it's going out 15 times a week now across the region. And our biggest challenge is being able to do it frequently enough, and so we're working hard to source more food so that we can send out more trucks. So that's a great example of what we'll be doing with this money over the coming weeks, because we know we need to do a lot more of that. And every place that we're doing a distribution, we're having a larger turnout than expected, and we're leaving empty. We're turning people away at the end of these events.
Thank you.
So Lauren, I don't know if there was any other TV or radio stations that we wanted to talk to. I know that we have Ruben that can do translation, if that's the case.
This is Elizabeth Torres on Radio KDNA. I do have a question. Is there any restrictions on how the people receive the food or the assistance?
We are not placing any restrictions. Everything we're doing is just folks can just show up and say they need help. We're not checking IDs. We're not asking for signatures. So everything Second Harvest does directly is wide open right now. Now, what we have, we do distribute through we supply neighborhood food pantries, and they get to set their own rules. It's a pretty organic system, but what we hear is almost everyone has lifted all those restrictions as well to make sure that the food is as accessible as possible. And of course, if anyone's running into challenges, we want to hear about it so we can reach out and try to encourage folks to make this. This is not the time to make it difficult to get help.
Thank you.
Allison or Austin, did you guys have any questions for either Second Harvest or GCACH?
Allison from Keeper, I would just ask Second Harvest, how awesome is it to get this check, and how many people do you think you guys are going to be able to help with these funds?
Oh, well, it's very, very awesome. It's one of the brightest spots over the last couple of weeks for sure. And it's one of the largest grants Second Harvest has gotten. So we're just incredibly grateful and thrilled. And this is going to be so helpful in the coming weeks. I think what's a little harder, it used to be pretty easy for us to say $1 equals 5 meals. But that was before COVID. Now we're finding the cost of getting food is going up pretty rapidly because of all the supply chain issues. So we're really struggling to source food in the way we did. We are finding success, but we are spending more than we have in the past to get food, and that's just what we have to do. You know, we will remain accountable and we'll share the results over the coming weeks and months. But at this moment, all I can tell you is that the expenses are going up. And, you know, it feels like we're spending anywhere from 25 to 50% more to get food than we did even 3 months ago.
Thank you.
You bet. Thank you.
I think we have time
like
for a
to
couple
point
more. Oh, go ahead, Ruben.
Yeah, this is Ruben. I would just like to remind the media outlets that join us that we sent out a list of the locations where people can go look for food. We have a list for every county. Also, that list with addresses is on Second Harvest's website in case you want to mention that in any of your broadcasts to let people know where they can find food in their counties.
Thank you.
Any other questions or comments from anyone?
I think we're good. Thank you.
Okay. Thank you, everybody, for joining us today. I think it went pretty well for our first virtual press conference. So thank you.
Thank you, everyone.
Thank
Bye-bye.
you.
Thank you.
Bye.